welcome to our other episode of Focus on This Week. This is a weekly program that brings you different current and dominating topics so as to influence positive change both within Tanzania, in Africa, and in the world at large. We're bringing you this episode from Julius Nyerere International Conference Center, where there is a celebration of the 20 years of the Mkapa Foundation, the foundation that was introduced by the late third president of the United Republic of Tanzania, the late Benjamin William Mkapa. And on this conference, we're examining the impact that he left through the foundation. On this episode, I'm your host, Caroline Meleon. Of course, we'll be together from the beginning till the end. And I'm bringing you a number of people to dive into the impact that Benjamin Mkapa had left in Tanzania, especially in the health sector. So stay with me from the beginning till the end of this program. This is Focus on This Week. TBC One viewers, on this very first segment of our program of Focus on This Week, we are sitting in an exclusive interview with Dr. Ellen Mkondia Senkoro, who is the CEO of the Mkapa Foundation. You're mostly welcome to Focus on This Week.
Thank you so much.
Dr. Senkoro, 20 years is such a huge milestone.
Sure.
And we clearly understand that the foundation was formed 20 years ago. Yeah. That's huge.
Yes.
What were the reasons now behind the formation of this foundation? And has those reasons for the formulation been achieved?
Yeah, the main reasons which started in 2006 was when the former president of Tanzania, President Mkapa, was stepping out of presidency office. And he decided that he should start a foundation, which is a non-profit making, in serving the people of Tanzania. And I think the main reason was because when he was stepping out, it was the time when we have very high peak of HIV/AIDS challenges within the country. And by then we had already started they had already started provision of antiretroviral therapies, ARVs. And if you recall well, then the government had allocated its own funding to purchase ARVs. However, there was a big challenge of not being able to access those medications in people living in the rural settings or underserved areas. And the reason was because we didn't have enough skilled health workers in those areas. So he started first the Mkapa Fellows program, which is our flagship program. That actually he started preliminary preparations in 2005, and then coming up with an umbrella organization, Mkapa Foundation, in 2006. So the reason was really to see how we accelerate the uptake of ARVs to mostly Tanzanians who were in need of that by that time. But also we realized that even if you give drugs, there's a whole question of monitoring those patients in terms of diagnostic services to measure their blood counts, their viral loads, their CD4 counts in terms of the immunity. We didn't have even those investigative diagnostic equipments in those facilities. So they're spread out in different parts of the regions. So this Mkapa Fellows program, when it started with the deployment of 3 professionals. They go as a team, that is a doctor, a nurse, and a pharmacist, or a doctor, nurse, and a lab personnel. And the reason is because we're just looking where are the gaps. Which are the hard-hit areas of the country that could benefit from these deployed Mkapa Fellows? And we started with the first 10 districts by deploying 33 fellows. Then we followed another 10 districts and then another 10 districts. And the story goes on and on. Now we are spread out in the whole country.
And let's talk about the conferences that are happening here in Dar es Salaam. This year's conference is focusing on, reimagining Africa's health workforce, innovation, leadership, and resilience. That's the theme for the conference for these first 2 days. Why is the health workforce now still one of Africa's greatest challenge in the continent? And what are you doing now to support the government in this?
Yeah, you're very right. Health workforce is still a challenge, not only in Tanzania, Africa, but also globally. And we're producing a lot, big numbers of graduates. And there's been a push towards that, which was good. And of course, I think that where we're coming from, we're very much inclined into giving clinical service. You know, let's produce doctors, nurses, pharmacists, etc., and going even further to specialized care. But we are realizing with time, we need to put a lot of efforts also on prevention. So when we're producing, we're just thinking of clinical care. Mm-hmm. But what is telling us now, times have passed. We've passed that level, because when we're producing, like now, we're producing almost 25,000 graduates every year. That's a lot. And we can't absorb all of them. Maybe we're absorbing less than half or around half of those. What about the other half? What are they doing? It means they have to look at self-employment. They have to go for private sector employment, maybe branch into clinical research, branch into medical journalism. You know, I was just challenging them, think outside the box, medical journalism. We need to think of what is really the context now, and so that we even adjust ourselves. But mind you, these graduates, when they are being produced from the training institution, they're not taught. Yeah. They're just taught to do clinical care. So even our training institutions need to adapt themselves with the changing context, you know, so that you can deliver and have graduates that are employable within the changing context. For instance, how do we have more experts on artificial intelligence? Health worker, a doctor or whatever it is, but in in artificial intelligence, understanding the digital aspects.
Thank you so much, Dr. Ellen Senkoro, for the explanations. And thank you for being with me on Focus on this week.
Thank you so much.
TBC One viewers, if you are tuning on TBC One right now, the program on air is Focus on this week. And of course, as I told you, we're here at JNICC here in Dar es Salaam. And right now, I am joined with Dr. Mpoki Ulusibisia, who is the Executive Director of MOI. Welcome to Focus on this week.
Oh, thank you very much. Thank you for having me.
Dr. Mpoki, we clearly understand that the country, Tanzania, continues to face the challenge of a shortage of health professionals, the health workforce. And now, from your perspective, what do you think are the biggest factors that are driving this gap, and what should the country do now to be able to close the gap?
Well, thank you so much for that question. Number one, we need to look at the population growth. We are growing at a phenomenal rate that alone suffices to cause those that have been deployed to offer health services to be in short supply. But the vastness of this republic is so huge, and everybody wants to be favored with access that is easy to health services, and then knowledge. Our people have acquired a better health-seeking behavior now than in the times past. So these three factors, I believe, they usually fuel the realization of how little we are in making good of the required numbers of healthcare providers. The government realized that for this nation to have a healthy population, the services needed to be drawn closer to them. So between 2016 and now, various places have had an improvement of health delivery infrastructure. Regional hospitals, district hospitals, health centers, and a majority of them in the health center were upgraded to come to a place where they will be able to offer surgical services to help mothers deliver who could not otherwise deliver. That was instrumental in widening the gap. That was already wide, but this made it wider. Because when you advocate for infrastructure, the expansion on the infrastructure aspect itself needs to have a measure of human resource for health to go and serve in those facilities. Unfortunately, it's very easy to build a house, but it takes many days to train health professionals. Nurses will require at least 4 years to become nursing officers.
And then they need another
doctors is 5 years. And then we have not even included the internship, like you're saying. And then super special, those kind of things. So when these health centers were built, and they had health commodities put in, that is the gadgets with which doctors employ in treating. And then we looked back and said, so who's going to work there? So everybody realized, we are lagging behind. We need to run. So in the short term, a few individuals had to be taken for a short-term training. 6 months, 1 year. Upon graduation, they would go. But in the long term, medium and long term, is to deploy individuals that will have been prepared to offer services in those places. We start with clinic officers, but a majority of the time we need medical doctors. Now, supplying the needed number is one thing, but being able to retain it is another. So if you deploy a person to the rural areas where a majority of our population lives, and that they find the environment not as supportive, I'm not talking about work, but see, life is more than working. A majority of them would just run and come back to the cities or to the urban areas. So this idea of lopsided development, where some areas are more developed than others, tend to create this shift that provides for a greater concentration in urban areas and a very little in the rural areas. And one of the other things that has contributed to this realization is that the curriculum that is employed in training these people has not addressed that particular aspect of deployment, preparing a graduate to go and work anywhere in the country. But number 4, when these people go far away from the urban centers, there are no mechanisms to retain them, like incentives. So like, if you say you're going to be deployed so many kilometers from Dodoma, but because you are this far, we shall make sure that you're provided with housing, we shall make sure that your transport is afforded, and there's going to be some allowance. This will keep many people stay there, while everything is available, including internet. Because I mean, how can you lead a life? But the other one is, we also need to up on the digital space. Artificial intelligence is supposed to be deployed in those places so that to ease the burden that these people will have when they work because of limited consultation as compared to places where more people come together and they can sit down and discuss a case. Because in medicine, it's about a teamwork. It's not just an individual doing those kind of things. So the absence of these factors makes it very difficult to say the human resource has been distributed countrywide equitably. Yes.
Okay. Yeah. And Dr. Mpoki, now with all that you have explained, what do you think is the youth role now in that? How can the youth be put in the health sector effectively?
I think 70% of our population is youth, is 30 years and below. What that means is they must be brought in now, not tomorrow, if we are going to gain the dividends of the investment in leadership, but also in responsibility sharing in our environment. We need to be tomorrow focused, not today. We need to think 50 years from now. How will the population of this country look like? And what will be their needs? So we start preparing now. A majority of the positions that are at our disposal are most of the time at appointments. I think the process needs to be competitive, that people should be allowed now to apply, and then they are interviewed. Those that excel are given those opportunities, and the processes be given them to facilitate learning, but also the room for practice. And these young people are very savvy, they're very intelligent, they are teachable.
Indeed.
Yes. It's like teaching an old dog new tricks. We need to teach them while they're young, all right? And that's the best time. And the other thing is, the world is moving so fast. If we do not allow them now, by the time we realize, we'll be left behind long time. Yeah. I worked as a hospital director in the Mbeya Zonal Referral Hospital for 1.5 years. I left behind a young person, I think he was in his 30s or very, very early 40s. What he's done, nobody has ever thought. Nobody thought that what they've done could be done. So that is the power that exists in the youth. And when I was working there, he was a very, very reserved person, just quiet, doing his work, going home. Work, going home. But then when he was given an opportunity to lead, everybody talks about him because of the great work that he's doing. That is what the youth need to be exposed to.
Indeed.
Give them opportunities.
Give them opportunity
Yes.
and trust the young people to show that they can lead. Dr. Mpoki, now as we are concluding with the interview with you, can you kindly tell us what legacy did the third president of the United Republic of Tanzania, Benjamin Mkapa, leave now to Tanzanians and to the young people?
The foundation has been a very, very strong advocate for equitable and equality health services in this country. When he was alive, even after he was gone. They deployed human resource for health in areas where people were not willing and ready to go. They found salaries for them before the government even had room to take them in. In other words, the health services were improved and the health of our peoples in those areas was made better compared to a situation where they had not had these qualified people to work for them. But the other thing is they also advocated for training, empowering these people with skills. So that means now we have a ready, skilled and able workforce to serve the people of this country. And they've given an opportunity for the youth to showcase their capabilities. I was listening attentively to Dr. Juliet Tibiesiga in the room. I was just floored by the eloquence that she manifested from personal experience as a medical doctor in Namtumbo, Ruvuma. Yeah, so this is what Mkapa'S been able to do. And I believe this goes on because this is just the third summit. Indeed. And I think 2 years later we shall be having another one. Looking at where we have come, where we've come from, where we are and where we want to go as far as the human resource for health is concerned.
And how do you anticipate now the coming, maybe in the coming 2 years?
Oh, I think we guys will just be in the audience and the youth will be everywhere. We'll be having permanent secretaries, we'll be having ministers, very, very young ministers articulating the health agenda of our nation. The health policy will have become a new one. The human resource for health policy will have been defined in keeping with the Vision 2050, but also walking in the footsteps of the policy for the health of this nation.
Thank you so much, Dr.
And of course, inclusion of artificial intelligence.
AI is the world. AI is the world, is the future.
That's where we go. That's where we are. That's where we go.
Yeah, thank you so much, Dr. Mpoki Ulusibisia, for all that you have explained on our program.
Me. God bless.
Thank you so much. We are joined with Dr. Ntuli Kapologwe, who is the Chief Executive Director of the East Central and Southern Africa Health Community, EXA. You're mostly welcome to Focus on this week.
Thank you for having me.
Dr. Ntuli, let's kick off. We understand that EXA Health Community is participating in this conference. Why is your presence important and what message have you brought to the young people here today?
Thank you very much. So, East Central and Southern Africa Community is intergovernmental and a diplomatic health organization. We were founded in 1974. Currently, we have 11 member states. We are home to 300 million people in the continent. But apart from that, we have 11 colleges. We call colleges of health sciences. And that's the reason why I'm here. For this legacy means a lot to the East Central Southern Africa community because Mkapa Foundation has done a lot in terms of workforce development in Tanzania, and we would like really to try to emulate some of the best practices from Tanzania and try to replicate in other countries in the region. That's one. Secondly, we as East Central Southern Africa Health Community, EXA Health Community, we launched the mentorship program. It's a regional mentorship program. We have 5 themes that we are focusing on, and we believe with what Benjamin Mkapa Foundation is doing, we can complement each other through the mentorship program and help these young people the emerging leaders to be able to deliver different interventions accordingly.
And we clearly understand that you signed an MOU with the Mkapa Foundation last year, if I'm correct. What has been achieved so far? And in terms of the mentorship program that you have had, what has been the impact now?
Yeah, so we have had a very good partnerships and collaboration. One, we were able to jointly develop the regional strategy for community healthcare workers development, which is a key component for the primary healthcare. And Tanzania is one of the exemplars in terms of the community healthcare workers development program. So we have done that one. But secondly, we want to work with Benjamin Mkapa Foundation in helping these colleges, which I've mentioned. In total, we have 11 colleges, which uses collegiate model or fellowship program, which allows one to attend the training, specialized training, while they are at the duty of station. And that has contributed to a 95 retention rate of the people who are attending. Because this is different from the conventional way of training, where people are moving into this classroom sort of training. But this one, you are attached to one of the healthcare facility. You are given number of procedures to attend. After time, sometimes you graduate, but within your setting, and that has helped a lot to retain healthcare workforce.
Okay, that's interesting. And Dr. Ntuli, can you kindly tell us, we understand that we are soon, tomorrow, actually, we are going to have the Mkapa Legacy Summit 2026, and the President of the United Republic of Tanzania, Dr. Samia Suluhu Hassan, will be the guest. Now, can you kindly tell us, what do you think is the legacy that Benjamin Mkapa left for the country?
I think the third president of Tanzania has done a lot, but for me, I'll always remember in terms of the decentralization of healthcare services, but also institutionalization of number of things, including the Tanzania Social Action Fund, which it is for pro-poor. And, you know, for the health sector to flourish, you need to take care of the poor. And that is, to me, a massive legacy as far as concerned. But also, if you want to achieve universal coverage, health for all, you really need to bring services close to the people. And we managed to do so through the this decentralization by devolution policy. So those are the things which I'll always remember him, and I think that is the living legacy up to now.
How do we integrate the young people now into the health sector?
We as Tanzania, like any other countries in the ex-region, 65% of our populations are those below the age of 24 years. So that's a huge population. I think the mentorship program, which X has started, we are working with the Benjamin Mkapa Foundation. We need to make sure that that works. That's one. But also creating an enabling environment for the young people to be able to deploy and to work in hard-to-reach areas. Initially, we started with Benjamin Mkapa. Number of district medical officers came from that. And even medical officer in charges for the district and regional referral hospitals came from that. We need to sustain those gains. It shouldn't be a one-time event. We need to create a movement so that people, they can continue doing that one. So I think at some point we were not able to do that, but this is high time we should be able to sustain that.
Indeed, it is high time that sustainability should be there. And now, while we are concluding, can you kindly tell us now, looking ahead, what success do you anticipate to happen maybe in the next 2 years when we'll be having another summit like this one? And in terms of the relationship between EXA and the Mkapa Foundation?
There are so many. Luckily, I had the privilege to be in the drafting team for the DIRA 2050 on the human capabilities in social development. And a number of the things that and themes that we'll be discussing during this summit are reflected into Tanzania Development Vision 2050. That will help to ensure the sustainability. And we know that Tanzania, together with other countries across the continent, we will double our population by 2050. Yeah. So that population growth should go hand in hand with workforce development. And this is where Benjamin Mkapa Foundation comes in, and it's where ex-Earth community want to work with Benjamin Mkapa to make sure that we realize that vision. Mm-hmm. Yeah.
So we're anticipating and hoping that by 2050, with the work that is being done currently, we won't have the challenge that we're having now of having the gap in the work.
Yeah, planning is key to that.
Indeed.
Yeah.
Thank you so much, Dr. Ntuli, for
My
your
pleasure.
time and for your contribution. Thank you.
Pleasure.
And now we are joined with Dr. Julieta Tibiesiga, who is from Namtumbo District Hospital. Doctor, welcome to Focus on This Week.
Thank you so much. I'm delighted to be here.
Doctor, you are from Namtumbo District Hospital.
Yes.
And you are a young person. Tell us, how is your experience now as a medical practitioner working in Namtumbo? We clearly understand that, young people with how they are, if you assign them to, the local hospital, to, the community hospitals, they wouldn't want to go. How has your experience been, and what has made you stay in the hospital to serve the citizens of Namtumbo? Give us your experience.
Thank you so much, and for this great opportunity to be interviewed, but also being delighted to attend the Mkapa Human Resource for Health Conference. Yes, so that's a very thoughtful question, and the experience hasn't been so quite smooth. I could tell the first 2 months when I arrived at Namtumbo, I got a bit of depression because the environment, which was, it's quite different from the environment that I was in for the past 7 years. I was trained at Muhas, which is in between the city in Dar es Salaam. And I also stayed almost 4 years when I was done with my education, the university education. I did my internship at Mwanyamari for a hospital. Still, I was in the city, and I engaged myself into different community activities within the urban areas. So being stationed at Namtumbo, it was the first experience being at a rural area, particularly on now hands-on practice in medicine. So first of all, I had to get used to the word Namtumbo because it was my first time hearing that word. And I was confusing that Namtumbo, maybe it's Nimtwara. I came to find out it's Niruvuma, you see. So then now I was, when you arrive at the council, they just position you further to health. The Ajirapoto positions you to Namtumbo council. Then when you arrive at the council, they position to another hospital. So I was lucky enough, I could say, because there are my fellow colleagues, then to deeper and other more rural areas compared to where I am. So being there, it has not been easy, but since we took an oath as doctors that we will provide quality healthcare services to any Tanzanian in this country. So I had that thought that if my parents are living in rural areas and they would like to be treated, why don't I take a role to treat other Tanzanians in Namtumbo? So that spirit and that passion made me stay up to this point, almost 6 months now into the system. Wow. And another thing, when I arrived in Namtumbo, I took the challenges as an opportunity. And I was privileged to be appointed as the coordinator of the Health Management Information System. So I'm able to see the data, the data pattern of different diseases in the hospital. And particularly, I picked up one challenge, which is the highest rate of teenage pregnancies. And I said, Julieta, you've been into adolescent health. Now this is the time to show your impact at this district and innovate something that could impact or could help young girls to stay at school, but also to reduce the number of teenage pregnancies, and enhance girls can meet their potentials. Being at a local place, which is Namtumbo, they can be productive and, meet their education potentials and be great people in this country. Yeah.
And Julieta, you're explaining your experience. You decided to stay, and you even saw an opportunity now to help, the children who are ending up having early or teen pregnancies. Yes. But what do you have to say to the young people who are assigned to go and work maybe in their communities and they do not want to go there. But for you, it has been possible. Yes. What's your message to the other young people?
I would say sometimes peer pressures do limit us to meet our potentials. The thing is, when you're done with your studies and now you are privileged to have a job position in the government, take that position, take that job, because things do change. You might be now a medical officer, you work hard and you leverage into other positions as before than how you started. So as any young health professional, when you're done with your med school and now you've applied for a job and you've been placed to any place in Tanzania, just go. Give a shot. Just go. And remember, not all of us, majority we are born from rural areas. We can't lie, you see. Picture the situation of where you were born and think about those people whom now you have been sent to take care of them and serve them. Yeah, so I would urge them to go. And don't complain too much. Sometimes as young people, we do complain and we limit now our thinking. We limit our innovation abilities. So when you get there to the community, use your skills, your knowledge skill that you got at the university. And lucky enough, there are councils where leaders are very supportive, from the Mkurugenzi to the DMOs, to the medical officer in charges. I'm so lucky to have such supportive leaders. So if such leaders are there, present your idea that please, now I have 3 months here, I have seen something, this challenge. Could we please work together to make sure, with the skill that I have, make sure we innovate and have such impact and legacy in our community? So that we don't need to sit and complain. Let's use our innovative ideas, our skills to build an impact into the communities where we are sent to work. Yeah.
And Dr. Julieta, with all that you have explained, maybe a young person is willing and is saying, okay, I'm going to go and work whatever it is that I'll be assigned to work. But sometimes, there's a challenge that the young people maybe are fearing that the environment might not be conducive, as you gave your experience and explained. What is your message to the policymakers? We understand that a majority of young people are complaining, the issue of not having jobs. And when they get jobs, they are still complaining that, I'm assigned to the community areas, the environment might not be conducive. What's your message now to the policymakers to ensure that as our government is strengthening the health sector, bringing the health services to the people in the rural communities, and they assign these young people, giving them maybe the jobs to go and work in the rural communities, the environment is conducive for them to work? Speak to the policymakers.
Thank you so much. As you've narrated so well and bold, that policymakers are the engine for us young health professionals to stay, particularly into rural areas. And this comes into two perspectives. The first, the incentives. When I'm in Dar es Salaam, the social services are available anywhere, I can move from Ilala to Kariakoo and get all the social services. But when I'm at Namtumbo, there are limited social services that I don't get in time. But when I say incentives, it's how to make sure to motivate us young health professionals who are into the rural areas to also ask ourselves to feel like we are being recognized, because we are attending a lot of patients in a very limited resources environment. But we strive, we improvise ourselves to make sure Tanzanians are well attended. But also issues around career development. We've been forgetting so much. They're giving you almost 3 years to first work and then join the career stage, the next career stage. They should think about to harness the potential of us earlier when we join the health system. And being a doctor, I might have some other potentials. So the environment should be created to allow me to show my other potentials apart from to the work reward rounds, apart from normal job description that I was given. They should allow us create some innovative environment, opportunities, and our policymakers should not see us like threats. We are very innovative. They should allow us to show our abilities and potentials. But also, the policymakers, I would urge them to strategize a very well strategy which will make sure young people are being retained intentionally and motivated. Sometimes you can retain young people, but you haven't prepared a motivative environment. Yeah. So the strategy should be clear that now when young people have joined the health system, these will be the incentives, this will be a path, these will be their mentorship opportunities intentionally. They don't have to speak and not act. They have to act of what they are speaking. Yeah.
And we clearly understand that we're remembering the legacy that was left by Benjamin William Mkapa.
Yes, yes.
What do you think is the legacy that Benjamin Mkapa left for the young people?
It's the build of working hard. Yeah. In his book of My Life and My Purpose, he wrote it very well, like pray and work, and the accountability of what you're doing, but also not waiting to be pushed. The legacy he left for us, for example, when I read his book, I see the self-motive within him, but also to not complain, to take challenges into opportunities. Yeah.
Thank you so much, Dr. Julieta Siga, for all the explanations that you have provided, and you clearly highlighted the role of the government, the private sector, and the youth themselves, to strengthen the health sector in the country. Thank you so much for your time.
Thank you so much.
And now we're joined with David Muhunzi, who is the youth track lead for the Human Resource for Health Conference 2026. Welcome to Focus on this week.
Thank you so much.
Can you kindly tell us, David, why has the conference mainly put focus on youth?
So the main reason we've put a lot of focus on youth, it's because of the demographic composition of our population. By numbers, Africa is the youngest continent in the world, and even our country has most of its population, over 60%, who are at the age of under 25 years. So when we are speaking about the DIRA 2050, 20 years to come, we are speaking about the people currently in their 20s, around in their teens. So that's the main reason why we put the focus on youth, because the demographic composition itself and then the country itself is a young population, and we expect them to play a bigger role in achieving whatever the aspirations that we have for the Tanzania Development Vision.
Mm-hmm. And what has been happening in the conference?
So for most part, we deep dived into 5 main frontiers. The first one is to understand now how this composition of the demography affects the way that policies are to be made. But also we went into discussing what kind of innovative technologies and emerging technologies that are currently reshaping the healthcare sector. We understand there are a lot of innovations that are coming from the young healthcare professionals with the potential to address the different challenges that is facing the healthcare sector in the country. So that is one among the main topics, to see how these kind of innovations can be financed, can be supported, and they can enter into the market to address the real challenges that are currently happening. But also another area which we touched based in one of the parallel sessions is how young people can be more participative when it comes to leadership and governance, especially in institutions where decisions are made. Because at the end of the day, if we are speaking about young people to become leaders of tomorrow, to contribute to the vision of the country, we need to ensure that their perspective and their views are taken into consideration when decisions are made. So we also discussed how the voices of young people can be reflected and how the young people can be represented in different decision-making institutions in the healthcare sector.
Now, before you explain the other parallel session, I was just curious, do the young people feel like they're trusted enough to be able to take these leadership positions? If we go back, I read somewhere that maybe the first minister's cabinet in the country was comprised of the young people during the leadership of Mwalimu Nyerere. They were comprised of young people. You could find ministers in their 20s, in their 30s. But now, do you think the young people are trusted? And do you think if these young people are even trusted, can they deliver? The ones who are already in the leadership positions, do they stand as good role models to make sure that the young people continue to be trusted, not only in the health sectors, but also in the other sectors?
Yeah, that's a good question indeed. What I think, in my opinion, the young people do not really feel trusted to become leaders. However, there are been some positive changes which have been happening recently to ensure that some of the decision-making positions are taken over by young people. But I think about being able to deliver, I believe they are able to deliver because we see in some of the institutions where young people have been trusted, there are a lot of changes which are happening. And the main advantage of trusting the young people into those kind of positions is the kind of perspective that they bring in, because you can imagine that currently in most of the institutions you find people in the generation of probably 80s and 70s, but a lot has happened in the past 30 years when it comes to technology, when it comes to innovation, when it comes to how new things are being conducted. So giving them positions into those institutions, bring that new perspective, that flexibility and creativity into the question, which in one way or another cannot be achieved if the young people are not put into the tables where the decisions are being made.
And you were explaining other parallel sessions.
Yeah, so another parallel session that we have conducted today, we explored the issues of mental health, because it's one of the sensitive topic, especially in the healthcare sector, because we expect these young healthcare professionals take care of people's lives. So it means their mental health and their mental stability is very important to ensure that those that they serve are in safe hands. So we discussed the different challenges around that, around burnout, around mental health, resilience, and emergency preparedness, and also discussed what are some of the strategies and interventions that can be put into place from systemic perspective that can address that challenges. In the last session, we also discussed the different routes of employment where these young graduates are expected to take part. We cut across the public service, the private sector practice. We have some other opportunities in entrepreneurship, technology, academia, and research to ensure that the young people, especially those who are currently in university, understand what is there for them when they graduated.
And do you think the environment is conducive for these young health practitioners to be able to go and maybe work in the communities, in the rural areas? And are the young people even ready?
Now that's the question of training. I think there is a mismatch. I think in one of her remarks, Dr. Julieta touched base that a lot. We are being taught to treat patients, but we are not being taught to handle the different environments that are happening on the grounds. For example, you find someone has been trained in Muhimbili, which is a tertiary hospital in the country, and then for 1 year they have spent their time in Aga Khan Hospital, for example, which is like a luxurious hospital, and then you find they're being posted somewhere in probably Ikwirili, for example. So now that kind of mismatch is not really taken into consideration in the training. I think a lot has to be done to prepare these young minds in terms of what kind of environment are they going to face when they go to different places. So I acknowledge there is such kind of a mismatch between being able to be a good clinician and also being able to handle the non-clinical challenges, for example, the environment, the burnout that are happening on the ground.
So there is a need for that to be added in the curriculum.
Yes, I think it's more of emotional intelligence kind of thing, and being able to move around those kind of political issues. So it can be considered as part of the curriculum, at least to prepare these young minds to navigate such kind of environments that they will face.
Indeed. And what do you think is the legacy that was left by Benjamin Mkapa for the young people?
I think one of the biggest legacies is the aspect that leadership doesn't really need you to hold a title. For example, you can be a leader in whatever the place that you are. You don't need to be the CEO, executive director, or medical officer in charge to show your leadership characters and to show that you can lead some other people. So I believe anywhere that you are, whether you are in a local hospital, you are in health center, dispensary, regardless of the title and regardless of the position, young people are being able to show that they can lead, and they can actually lead in terms of bringing the innovation, flexibility, and creativity in place.
Is this value in the young people of this generation?
Yes, I believe, yes. For most part, it is. Yeah.
Okay. Thank you so much, David Muhunzi, for the explanations that you have provided. Is there anything else that you wanted to speak to the government, to the private sector, and to the youth?
Yeah, I think to the government, because currently our training institutions produce over 21,000 healthcare professionals every year. But then you wonder, we have a gap of about 200,000 healthcare workers in the country. So we produce more talent than the system can absorb. And as we are speaking, we are operating at around 45% of what is really required to sustain the healthcare sector. So a lot has to be done from a multi-sectoral point of view in terms of now how do we absorb the kind of talent that we produce, how do we motivate them to stay and grow within the system, and how do we actually retain them within the system. And this is, for most part, it's not only the government that has to do it. It also involves private sector, academic institutions, and different other partners, because as you can imagine, the government itself cannot absorb all these kind of partners. But then for private sector, I believe there is a chance of, because one of the interesting facts is that currently the young people themselves are creating employment. Some of them are not waiting to be employed, but rather creating employment for themselves and for their colleagues, especially through innovation, technologies, and digital transformation that we see currently happening. But one of the challenges that faces those kind of transformation is now how those ideas are taken into pilots and partnerships that are being deployed in the healthcare sector. So I think different partners can come together to ensure that the environment is conducive for such kind of innovations to come from the ideation stage, and then be able to access financing, whether in terms of equity grants or another type of financing, and then get a chance to form commercial partnerships with different institutions so that they can pilot their solutions. So I think that's what I can advise.
Thank you so much, David Muhunzi, for all the explanations that you have provided. We are now joined with Dr. Alex Gasasira, who is the country representative of the World Health Organization. Welcome to Focus on This Week.
Thank you very much.
Can you kindly tell us the work that WHO is doing in promoting the health sector of Tanzania in general?
Thank you very much. So the World Health Organization works with its member states, that includes Tanzania, to promote health and well-being through strengthening national policies, strategies, planning, based on evidence that have been generated across the world, especially countries that have similar context to what we have here in Tanzania. So right now we are really supporting, strategies towards universal health coverage, stronger primary health care, supporting countries to be better prepared for health emergencies, and those are, and promoting health, preventing disease, and promoting health and well-being.
What about in terms of the breaking diseases that we're seeing, maybe Ebola that broke in Uganda, in the DR Congo? What about in terms of those diseases?
Yes. So health emergencies are now becoming a major challenge for health systems across the world, especially in our part of the world. And outbreaks such as Ebola, outbreaks of diseases that are promoted by what we are seeing, climate change, closer interaction of human beings with environment, with animal populations that carry diseases that ordinarily would not cross over to human beings are becoming more prevalent, Ebola, Marburg, and the like. So we are supporting countries to build their systems to ensure that when such diseases happen, they are detected early, because early detection helps countries to stop them before they spread. and before they cause great destabilization. Early detection, timely response, and controlling as quickly as possible.
And if the WHO is doing that role to ensure that the member countries are having strong health systems, what about the role of the young people now in this?
So the role of communities, of people in stopping disease, in ensuring timely detection is critical. And young people are the most vibrant members of our society. Young people have more innovative ways of, addressing issues, knowing how to address issues as soon as they occur. The young people have better knowledge about communication strategies, about technology. So the role of the young people is paramount. And so they are key to this endeavor.
And actually, we understand that Africa is emerging as a global leader in health issues now over the next 2 decades, maybe. So what bold decisions should governments take to ensure that, we support this transformation? And how is WHO now going to make sure that Africa is able to transform in the health sector?
So we are seeing more and more of our African leaders prioritizing health. In the past, governments used to think health was a cost, not an investment. Yeah. Now, more and more of our leaders are realizing that a healthy population is key to development, to economic vibrancy. And this is key. This is something that WHO is really advocating for, and we are very encouraged by how many of our leaders are playing this role. And through the leaders, the whole government structures. But this health cannot be left to government alone. A stronger whole of society, government, private sector, communities at the heart of this. So everybody has a big role to play. And I'm very personally encouraged by this conference that we are attending to see young people from the private sector with ideas that they have generated, which are contributing to promoting health. So this is the way to go, and this is what we are strongly advocating for.
And do you think the ideas that the young people have contributed, as you're explaining, will they be implementable? Are they trusted enough that the ideas that they give will be taken into implementation in the health sector?
So the first thing is to bring the young people to the decision-making platforms, like what we are seeing today. Ensuring that their ideas are put forward in front of the decision makers. Once the young people are given that opportunity, that is the way to go. In the past, they didn't have the opportunity. So they would have the ideas, but they would not be together with the policy makers, with the decision makers. So I think this is a very, very good way to go. What WHO has started, for example, is having youth councils, whereby youth are invited to all our decision-making platforms and contribute ideas, and this is being promoted. And because our decision-making platforms bring together ministries of health, governments are taking this idea and taking it back home. So I think we are in the right direction. It just needs to be supported.
Indeed. And if we are on the right track, on the right direction, the youth have been put on the table with the decision makers to give their views. How do we ensure that now, because we have moved forward, we're here, that this actually, the next step is implementation? Who should be there to make sure that these policymakers are accountable? That whatever it is that the youth have suggested, which is correct and can bring development in the health sector, is actually taken into consideration?
So I think we all have a role to play. And again, this very platform that we are on, the media, making sure that this information is shared with populations, our elected representatives, our elected leaders, all of us have a role to play to ensure that these good ideas are actually supported and translated into actual implementation. We who partner and support governments as development partners have a role to continue to advocate for this and to continue reminding the different stakeholders about the key importance of having youth at the table.
And can you kindly speak to the people, the viewers, on how it is very important to protect their health, because development goes hand in hand with, proper health of the people. Speak to the viewers.
Thank you. So yes, a healthy population can contribute to our development as a society because they contribute to the economy. They are productive. If we are healthy and we have good ideas, we are strong, we are able to work, we contribute to our economy and our development. So health is all our responsibility. A lot of health is about adopting healthy lifestyles, not waiting until we get sick. In fact, most of what we can do to improve our health is prevention, is promoting good diet, good lifestyle, avoiding, things like alcohol and tobacco, and we will be productive members of our community and our society.
Thank you so much for your contribution, Dr. Alex, and for your time.
Thank you very much for having me. Thank you.
Indeed, the late president of the United Republic of Tanzania, Benjamin William Mkapa, had left a lasting legacy 20 years later after the formation of the Mkapa Foundation, but also after his passing. The legacy continues to live as he's trusted the young people. He promoted integrity, and this is the legacy that continues to live on until today. We're seeing in the current president, under President Samia Suluhu Hassan, she trusts the young people, and they're taking up spaces, and we've seen there's the ministry responsible for youth here in Tanzania. Until next time, this is Focus on This Week. On behalf of the whole team, until next time, goodbye.